myself and my colleagues here at the group, we decided to nominate Dr. Naylor for a Distinguished Physician Award, realistically just because of who he is. I am kind of in the middle of the group in regards to partners, and I have a few senior partners and a few junior partners. And after we reviewed kind of the application form, we thought there's no better person who would fit in for especially the distinguished physician like Dr. Naylor.
Dr. Barclay had actually come to us regarding the Distinguished Physician Award, I believe with Dr. Steinas, and asked us all if we thought this was something Ken would be good for and if he deserved it, and of course all of us said 100%.
When I went into medical school, I thought I wanted to be an orthopedic surgeon. And my wife said, well, you can do anything but become an obstetrician gynecologist. So I don't know if that's why I did it. No, it isn't. But I loved it in medical school, and I've just always really enjoyed taking care of women. It's a great career. You develop so many great relationships, and you can just really have a huge impact on people's lives. To provide quality care, it has to be a whole team approach, whether it's here in our office or over at the hospital, or when we go on these short-term medical missions that we've done through with Genesis's help. It requires a whole team. It's not something just one person can do.
Things that make Dr. Naylor a good physician, honestly, there's too many to count.
The way that he practices is something that I think all of us should emulate. He's very fair, he's very up to date. I would tell you that I think he knows things that come hot off the press, and he's always the person that we always turn to when it comes to, I think, major decisions, not only from a clinic perspective, but from a patient care perspective.
I think delivering babies is just a great thing. It's a priceless gift, to be involved in that. It's one regret I have is I should have counted all along, because I'm asked that all the time now. I don't know, just based on our typical delivery volumes and everything, probably between like 3,500 and 4,000 births, I would say. In our group, the biggest change is when I started 31 years ago, it was all men in our practice. Now I'm the only man with 6 women, which is great. The discussions, I've loved all the doctors I've worked with, but the things we talk about in our weekly meetings now are very different than they were, 30 years ago.
Having Ken as the only male doctor is actually kind of fantastic. He can offer a little different perspective on things. He does help out with kind of the father of the child view with our pregnant patients, and maybe a little bit more of the patriarch of the group. It's just really nice to have that dynamic in our office.
So Dr. Naylor, when it comes to quality care, I don't think that there's anybody else who provides it more to a T as he does. When I say quality care, he is always the one who is looking out for the best for the patient as well as the best for the family and its whole. We have several members of the community who have come back and said, Dr. Naylor has not only taken care of me, but also various family members.
Yeah, I think that I just want to provide just quality care and just develop good relationships with patients, and help them feel comfortable with what we're doing. Continuing to grow and just provide excellent care for our patients, I think be a great legacy to leave, quality safety care and everything, as well as continuing growth at the hospital, at Genesis as well, in those areas.